Everyone, welcome back. I'm Sara Pantuliano. I'm the director of the Humanitarian Policy Group here at ODI, and I'm delighted that we're hosting this Urban Day at ODI today. I have been focusing on urban issues throughout my career, starting with my PhD, and in the humanitarian team at ODI, we've actually been doing quite a lot of work, particularly on urban displacement. So I'm really pleased that we're finally tackling urban issues as an institute-wide concern. And of course, Caroline, you were here many years ago, and that was, one of the great strengths of your presence at ODI, which had been lost over the years. So it's great to see the institute refocusing on this. This particular session is actually going to look at issues of safe cities. It's titled Towards Safe Cities, and we wanted to make sure that we had a discussion on that because this is becoming a pretty critical issues in a number of countries. I mean, cities can be fragile, insecure, despite being located in very stable states. They don't need necessarily be at the heart of a conflict or a country, where there is an armed conflict, to reach the intensity of violence that is associated with a war zone. And yet, this is, an issue that is very difficult to navigate, particularly in the humanitarian community, when a country is not at war, and how to engage in this context. And traditionally, there is a challenge of bringing the humanitarian and the development community together in most contexts, but even more, in urban settings, where the two rarely work together. Over the last few years, we've also seen a massive increase of, this refugee presence and internally displaced people presence in urban settings. I mean, today we have a world refugee population of about 17 million and about 34 million IDPs, and about half of them are estimated to be in urban centers. So imagine what this means in terms of the added pressures that it brings in terms of absorption for the host communities, which inevitably often leads to tensions and the difficulty that states have to manage that. But also we know the urban centers, and I'm sure you've discussed that this morning, are magnets for young people. Who, invariably in many contexts face challenges in accessing employment or have very, precarious, insecure living arrangements and, are exposed to extreme hardship, to violence and abuse, to social and economic marginalization. With colleagues in my team, we did quite a lot of work on urban displacement, and what emerged very clearly was also, how prone, a number of these young refugees and young displaced people were to recruitment into gangs and organized crime in town. Now, the violence by gangs and this turf control have really turned many cities into no-go zones, where it is very difficult for the state to ensure law enforcement, but also for international humanitarian development actors to operate. So the focus of this session is to explore some of these challenges, how the interplay between urbanization, conflict, and violence disasters can lead to a rethink about humanitarian development action in cities that experience chronic or acute fragility. And to discuss this and issues of a fantastic panel with me. I'm really delighted. Two are with us in London, and other two are joining us by video link. To my left is J.D. Gupta. J.D. is a research fellow at the Institute of Development Studies. J.D.'s research interests include urban violence, micro-level politics and economics of slum resettlement, informal justice, security in slums, and also GIS-aided mobile data collection platform for spatial research. Your main countries of focus, JD, have been India, Bangladesh, Nepal, Sudan, and Nigeria, so a wealth of places to draw examples from. To my right is Caroline Moser. Caroline is an emeritus or emerita, we were debating, professor at the University of Manchester. Caroline is an urban social anthropologist and a social policy specialist, has more than 40 years of experience on these issues. Her research interests include urban poverty, urban violence, household asset vulnerability and accumulation strategies, and gender and development. Caroline has been leading a recent project focused on asset adaptation to climate change in urban centers, working particularly in Mombasa in Kenya. We're joined by video link by Gary Slutkin, who is the founder and the executive director of Cure Violence prevention NGO that stops the spread of violence in communities by using strategies associated with disease control. It's fascinating. I'm really looking forward to hearing more about it. So Cure Violence started in Chicago, and this public health method is being replicated in more than 7 countries abroad. He also served as the medical director for the tuberculosis program for the San Francisco Health Department and worked for WHO for a number of years. And then last from Rio, we're joined by Connor Foley. Connor has worked for a very large number of organizations, including UNDPKO, UNHCR, Habitat, Amnesty International, in more than 20 conflict and post-conflict zones. And his expertise includes human rights, mediation, post-conflict, humanitarian aid, rule of law, governance, community justice, and land rights. Connor is a visiting professor at the Pontifical Catholic University of Rio de Janeiro and also a visiting fellow at the University of Essex and a good friend. So I'm delighted to have them with us. And I'll start by asking each of the panelists to really tell us a bit more about their research. What you're really working on, what some of the issues that you think are particularly challenging, interesting, critical, to analyze, but also to, find better strategies and approaches for. And I'll start with you, Jaydeep.
Sure. Thank you so much, Sarah, for having me here and to be part of this. It's really good to be here at ODI. Perhaps I should sort of give a little bit of context to this. I mean, my interest in the broad field of urban security, urban violence, I often trace back to growing up in Mumbai and sort of in the mid-80s, early 90s, reading about the very violent and authoritative actions that were being taken by the Mumbai police at the time to counter the sort of the gang culture that had in some ways taken a hold of the city. And yet, I remember my childhood being extremely peaceful. I don't remember or don't recall much of the type of violence you read in the newspapers happening in the neighborhoods around me, even though we lived in what is so-called a low-income neighborhood. And so, I often sort of found the juxtaposition of those two extremes quite interesting and at times difficult to understand. And of course, that led to reading a lot of the work of people that you've had involved in today, including Caroline, David, and others. The issues that sort of drive my research at the IDS now stem from that, really. I spend a lot of time looking at the micro-level dynamics, as you said, of urban violence. And in particular, I approach this through an individual or at times a household perspective. We try and add a spatial lens to it, where we're trying to map where violence occurs, the actors that are involved, so an understanding time and space in a city, not just sort of in its physical parameters, in its physical form, but also in its socioeconomic and political forms. One of the key themes that also sort of drives my interest in this field currently is understanding urban policing. Now, this often gets a lot of media coverage when things go extremely bad. So when there's citywide rioting, for instance, the police often critique, but very, quite often the same amount of attention isn't given to issues of sort of capacity building within the police, the types of interventions that they're involved in. And so that's an area that is driving a lot of my work. I'm increasingly interested in the technological aspects of urban policing. And as sort of is the call of the day, a large sort of part of my work currently is also involved in doing some sort of a bit of future thinking in terms of what security challenges might look like in years to come. Particularly as the world urbanizes faster, more rapidly, and the types of infrastructure requirements for cities in the future are at a nearly monumental scale. And so a small subsection of that is to look at how policing might be undertaken and by whom in the future. So I don't know if that sort of covers.
Well, that's definitely something that we can explore more in the discussion. When we did research in Nairobi on urban refugees, the issue of policing was definitely one of the most critical elements, underexplored in policy, in development approaches. That was actually the most critical daily, grind for people, particularly for refugees who didn't have legal papers, perhaps, or were more vulnerable to police abuse. So that's definitely something to touch on, and I'm sure we can pick it up, in terms of discussing some of the experience from Rio and other places with Connor in the debate. Caroline, tell us a bit.
Okay, thank you very much. I want to start by again thanking ODI for inviting me to be here. I enjoyed this morning very much because we had case studies that gave us historical context in the work they were doing, and I wanted to do the same on my own work on urban violence in just the few minutes I have. My work is grounded in longitudinal research in Guayaquil in Ecuador. And when I was there in 1992, local community members started to talk to me about the way their neighborhoods had become increasingly violent. It was a time when we were doing research on the impact of structural adjustments on poverty and inequality, but they highlighted this issue. In 1995, which is 20 years ago, I was at the World Bank and I undertook a participatory urban appraisal of violence in Jamaica because they were about to implement a social fund, and they suddenly realized we can't do something in Jamaica if we don't understand anything about violence. And this was followed by some in-depth work that I did with Kathy McElwain, where we did 9 city studies both in Colombia and Guatemala using the same type of methodology. The interesting thing was at the time, violence wasn't considered a development problem. It was one of individual pathology, and the intellectual domain was very much dominated by criminologists and epidemiologists, both of which, of course, are critical today as well. But coming into it, people sort of confronted one and said, what are you doing on this subject? This is something, and as I say, I don't come from that background. The result was, when I was in the bank, we did the first what's called economic and sector work at the ESW on urban violence in Colombia, which is a country I actually did my PhD in know very well. And what happened in the middle was it was overtaken by conflict. And the conflict guys in the World Bank said to me, "Oi, this country is ours. This is a conflict domain." And I raised this point not to be anecdotal, but to say that these worlds merge and mix, and language merges and mixes, and which one are we working on, which one aren't. 10 years ago, David asked me to do an a special issue, environmental and urbanisation, and where I introduced a roadmap. So if in the 1990s people thought it wasn't a development problem, by then, 10 years ago, people thought it was like poverty. It was something that was a development issue, but it was an optimism. If we understood it better, we could reduce it, and with additional resources and policies shifting towards safety and security, we could solve the problem. And notice by then, when the UN agencies, particularly UN Habitat, took it on, the language changed. So we're not talking about violence anymore, we're talking about safety, because we have to be positive and upbeat, and that's what safety is about. So that has happened, and of course I'm part of that because there's a lot more research than resources for research. And actually the last job I had was at the Global Urban Research Centre at Manchester, and we did a very interesting 4-city project on tipping points of conflict, urban conflict, if you're thinking about new ways of looking at this issue, in 4 cities across the world, and also looking at violence chains as a way of looking at the concept of taking the concept of economic chains and looking at them from a violence point of view. Last year, actually, I did a second edition for David of Environment and Urbanisation, and pulled together a lot of the people that have worked on the earlier edition and said, let's review where we've got to. And the interesting thing is that there is no longer the optimism that there was 10 years ago amongst development practitioners. And that this is a time-bound issue that's going to disappear. We now recognise that it isn't going to disappear, and that in many ways it may be an integral part of the current development model itself. So while it may deepen, transform, and mutate, violence is here to stay. So there's been an extraordinary change in this period. Now, along with that, which I won't go into here, but maybe in the Q&A, is also the introduction of resilience and fragile cities and all sorts of other things that have come on board. But I think that the first thing that has now happened as we think about violence, and this is where we are now, is that we need to recognize that it's not going to go away, and therefore we need to have multiple approaches to think about the issue, so that we are talking, and we've got an excellent colleague who is in a violence prevention program. We also need to think about how do we reduce conflicts. We need to think about how we manage and control manifestations of violence. And finally, we need to think about, and it very much links to what was being discussed in the previous session about local communities, people themselves who are vulnerable, how people and local communities can empower themselves to contest and conflict and confront the structural underlying causes that lead to violence. So we've come a long way, and in coming this far, we are much more aware of the complexity of this issue and the fact that there are not simple solutions to it. So that's, I'm going to leave it at that.
Thank you so much, and I think that's what we'll really, try and discuss. I mean, what these multiple approaches can be, and more practically can be done more both, in policy terms and programming on the ground, to see a change and regain some of the optimism that has been lost. Gary, tell us a bit more about this, really exciting sounding set of initiatives that you've been promoting.
Yeah, thank you very much. Can you all hear me?
Yes, okay. Very well.
Yes, very well.
Oh, great. Well, good afternoon to you. It's my morning. And thank you for inviting me, and thank you to the ODI. Well, let me tell you what my background is and how we're approaching this problem and what we're learning about it. So I'm a medical doctor by training. Largely, I'm an infectious disease doctor, and most of my career I was working on epidemic infectious diseases, mostly in Africa, a lot of that time with World Health Organization. So I lived in Somalia for 3 years, where I was working on tuberculosis and on cholera, and that's what I went there to do. I worked with the Refugee Health Unit, not with any international organization, just with the country itself. And this is where I learned through tuberculosis and cholera how to prevent things that spread, that have characteristics of spread, where one event leads to another, and how you interrupt the transmission and then reduce the amount of it, the rates, and so on. And then after Somalia, I got picked up by World Health, and I worked there for nearly 10 years on the AIDS epidemic, also mostly in Africa. And I was responsible for the Uganda program, which was a behavior change program, and the 13 to 15 countries that surrounded Uganda, Rwanda, and Burundi, and what was then Zaire, and so on. And it was in that work that I was really learning about behavior, which was a far cry from ordinary infectious diseases or ordinary spread issues. It was about behavior, actually sexual behavior, which was a very, very, very hard behavior to change. Actually much, much harder to change than violent behavior. There's actually no comparison. Violent behavior is much easier to change, because people actually don't want to change their sexual behavior, but they really don't want to be doing this violent behavior, except they're kind of driven by their friends and groups and so on to do it. So anyway, I learned a lot by hiring a lot of good behavioral people at World Health, and then I took a break and kind of bumped into this problem of violence, which was not where I was headed at all. I wasn't really particularly, I was always afraid of it, and it had affected everything I did. I mean, from the refugee thing, which was because of violence, and even HIV was being spread by violence. But I wanted to take a break, and I came home, and in the US I was told about this problem of kids shooting each other. And to make a long story short, we spent 5 years just trying to figure out a new way into this problem, seeing it as a stuck problem. And being aware that punishment is overvalued and that all these other so-called underlying causes were also thought to be the case with tuberculosis and cholera and many other things, but we always were able to find some down the middle pathway. So we went about 5 years of strategy design and developed something that's kind of based on disease control. And it uses health workers. They don't exactly always, they're not always seen as health workers, but we hire people from the groups themselves, whether they're cartels or gangs or militias or tribes. We hire people to interact with their own, just like we hired sex workers to interact with sex workers or refugees to interact with refugees. And we train them very extensively in how to do persuasion and essentially behavior change. So the first time we put this into motion, we got a 67% drop in shootings and killings in the most affected police district in the United States, which was in Chicago. And then we repeated that now about 40 times, and we've had 5 independent evaluations, and we don't usually get that level of reduction, but the independent evaluations are showing between 30 and 70% drops in shootings and killings. And these are evaluations that have been done by the Justice Department, the CDC, and Johns Hopkins. So we're now working with this method in Jamaica, in Trinidad, in Honduras, and San Pedro Sula. We're about to start a couple programs in El Salvador. We're working in Juarez. In South Africa, in Cape Town, we're getting 50% drop in shootings and killings in Hanover Park in the Cape Flats. We did some work on the Kenya election, the last election, with Ushahidi and a few others. We worked 6 years in southern Iraq and in Basra and also in Sadr City. It was very hard to measure there. We're getting 50 to 70% drops in Honduras now. So this is a method that thinks about it differently, that acts on it differently. There's several stages to it. It's very systematized, the way that we have systematized HIV prevention or TB control. And it's basically a health-based behavior change method that reduces spread. That we work with indigenous, very, very, very local groups. Sometimes it's a pastora, like in Honduras. Sometimes it's a non-governmental organization that no one even knows their name. And our job is to transfer the method to other organizations and groups.
Great, thank you so much.
I should tell you that the whole business of violence as a contagion. There's a lot more research on this now. I really didn't. I wasn't really thinking about it in this way when we first started to work on it. I just saw it as a strategy problem, and we were developing strategy for TB and revising strategy and developing it for HIV. And I just went about it as a design strategy thing. I really wasn't so awake to it as a contagious process. But subsequently, the Institute of Medicine has done a consolidation of the dozens of studies that are showing this as a contagious issue. And also between syndromes, war leads to community violence. Post-war, there's frequently more violence. People exposed to war do more violence in their home. So it's even contagious within syndromes. And also vertically, people are abused as children. They abuse their own children. 30% of them do, and why would they do that? It's because the brain is picking this up in a contagious way. So this is the way that we're approaching it, and kind of the practice is confirming the theory, and the theory is, driving the practice. But it didn't really start that way. It really kind of started by practice and by trying things. Unconsciously, maybe, using some of the methods we'd used in refugee camps and in other places like that for other problems. I mean, what's I think optimistic about it is that, It doesn't deal with all of the issues that most people are interested and concerned about, including myself, poverty and poor educational systems and all of these things. On the other hand, it opens the way for people to get out of some of those difficulties because it can make neighborhoods safer. And, usually, actually, the results are fairly fast. I mean, usually in the first year, it takes a while to set this thing up. And it certainly takes a while for
I have to stop you here so we can get Connor in as well. I think this is really interesting. I'm sure there'll be a lot of questions, to understand better the model. But I want to give Connor a chance to talk about the work he's doing as well, and then we'll open up the discussion to a number of questions that will bring in all the inputs from all of you. But thank you very much. That's fascinating. Connor.